Hey, are you okay? So we're come to the Bell-Kenz Sagip CPR activity here at Southwestern. Not all heroes wear capes, so they're training kids to do CPR. And we are here.
And then we start the CPR box of the CPR.
So they're teaching elbow straight.
Then, after the 120 per minute, allow touching oil, and then you proceed with your CPR. Ready? Get set.
Go.
Go.
So that's the rhythm, guys.
Not too fast.
Go.
Okay. Are you okay? Now the patient is unresponsive. Step 3, call for help and eucalyptus AED. Next, fingers interlaced, shoulders perpendicular, elbows straight. Okay, rate of 100 to 120 per minute, and you allow chest recoil. Okay? Ready? Get set.
Go.
Go.
Allow chest recoil, huh?
Stop. Not too fast.
Wala ng trip man. No.
So to officially wrap up this life-changing day, please welcome our programs manager from Bell-Kenz Pharma, Mr. Hands-Only for the closing remarks. A round of applause for him.
Okay, good morning. Okay, with us here in Bell-Kenz CPR, we're very thankful and would like to give each and every one of you our heartfelt gratitude for participating in our Bell-Kenz CPR. So our Bell-Kenz CPR has been running since August of last year, and it's our very first time to conduct it here in Cebu, and the third time in conducting with PHINMA Education. We started it with PHINMA Cagayan de Oro, to be followed by PHINMA in Manila. Then this is our third time with PHINMA, in line with our continuous partnership with PHINMA Education. So we hope that all of you, that each and every one of you have learned how to do CPR, and you can use it in times of emergency. And I hope that each and every one of you will be a hero in the community. So, give each and every one of you a big round of applause, man. So, on behalf of Bell-Kenz Pharma, Bell-Kenz Education, and Bell-Kenz CPR, we're very thankful, and good morning, everyone. Thank you.
This include activity, guys, and I guess it was a fun activity that, you know, attended with doctors, students.
So today, we are doing this Sagip CPR activity. Actually, it's the advocacy of Bell-Kenz Pharma. They teach hands-only CPR to as much as many people. Kaya kani man good cardiac arrest, pwede na siya may tabuk, no? Bisag kanusa, bisag kinsa. So usually we encounter this sa mga community then most of the people di kabaw mo CPR. Well, in fact, kung makabuhat lang yun sa CPR, we can save a life. So this advocacy actually is to teach women, no? It does not necessarily mean na dapat naka sa medical field to learn CPR. So this one, as much as possible, students, lay people, barangay health workers, we want to teach them the hands-only CPR. So by doing so, we can save a life. So it's a simple 3 steps. Check, survey the scene, check for responsiveness, and doing the hands-only CPR. So by doing this, we promote hands-only CPR to the community. Para if we encounter patients na nag-cardiac arrest in the community, lay people can do hands-only CPR.
How many participants do we have for today?
For today, we roughly have around 1,200 participants, but I think more are coming from the community. But these are registered students, but there are also people from the community.
Somebody sa barangay?
Yes, first time
For example, who-
affiliated nila na partners.
Just a brief introduction about Bell-Kenz Pharma, because I don't think we've done much communicating with the Cebuano public in the past. So I thought it would be a great way to introduce ourselves to us from the point of view of corporate branding and public affairs, no? Which me and my team, we are in charge of. So yun, no? So this picture, actually for me, it was just, we were brainstorming in our office with a creative team. We have a in-house creative team, and how we could sort of dramatize the impact of the emergency, the energy crunch happening right now, no? So, ayan, no? Parang the Alcansha is shivering for his life, no? Because now I think the crisis is pushing a lot of families, a lot of people to the brink of the financial, because of the heavy financial strain the oil increases have had on our pockets, no? So, ayan, bago humantong dyan, and I think this fits perfectly well with Bell-Kenz, no? Ang tagline kasi ng Bell-Kenz is we make life better, no? So para sa amin, the role the company plays now is even more, it comes into sharper relief, no? Because see, Bell-Kenz is not just a pharmaceutical company, as our tagline says, we make life better. So hindi po siya parang of course it's a business, no? But we realize there are certain realities to doing business in the Philippines, particularly in the pharma space, where a lot of people, we work a lot with cardiologists, for instance, and 47% of our product portfolio is cardio. A lot of people are not able to maintain their regime, no, of medication simply because of the financial strain.
In charge and the project lead of the PHINMA Education First 1,000 Days program in the Philippines across all our schools. So this afternoon, I'm very happy to share with you what we do with PHINMA Education F1KD. That's first 1,000 days, means F1KD also. And how we use this program to imbibe also in our students the culture of service and care. But before that, we are very grateful about our partnership with Bell-Kenz Pharma Inc. and the Bell-Kenz Pharma Foundation Inc. As a partner, as our very engaged partner in this program. So, like what I said, PHINMA Education mission is always been making lives better through education. But through our community activities, community programs, we realize that education does not only start when the students or when the child enters the classroom. In many ways, it even starts way before that, earlier. And it starts from the womb up to the 2 years age of the child. So from pregnancy of around 270 days, and then important din ang bata from 0 to 6 months and 7 to 2 years or 550 days. Bakit critical siya? Kasi this is where the growth, the physical growth and brain development happens. If the child from the womb is not properly nourished by the mom, where the brain will really have an effect. Usually, they say after 5 years old, the brain is already not functioning 100%. Well, we could say it's my brain damage na, no? So, while we want to take care of this, like what I said earlier, around the communities where our schools are, we support 10 moms per school. We have 7 schools as we started, and the realities where our moms are living are basically the same like nakita ninyo sa paligid natin dito sa Cebu. In Cagayan de Oro, for example, this mom that we are supporting lives very far. We support one barangay named Barangay Carmen, which has 90,000 population, parang bayan na siya, no? And this is one of the biggest barangay, I think, in Cagayan de Oro. So this mom lives very far away, no? And so the access to services like prenatal and other cares, parang hindi niya kinukuha dahil nga malayo at wala siyang perang para sa pera. Under 5 is stunted. So we are 117,000, I think, 117 million population. About 13% of them are children under 5 years old. And 1 out of 3 is stunted. That's about 5 million, more or less. The next sad thing as well is that 2 in 10 Filipino pregnant women are found to be anemic, which can lead to premature birth, low birth weight, and poor child development. The doctors say that an anemic pregnant woman gives birth to a stunted child or stunted baby. Lahat naman dito, around $8.5 billion is lost in the Philippines each year due to malnutrition. Ano bang ibig sabihin nito? Kasi kung ang bata ay sa first 1,000 days pa lang ay stunted na, hindi malaki ang probability na ma-develop yung kanyang brain until 5 years old. Kaya importante yung first 1,000 days.
40 different places in the Philippines in partnership with schools like PHINMA and LGUs as well. Like we've been to Naga, we've been to Vigan, General Santos, Cotabato, and so Cagayan de Oro, where we launched. He was saying, of course, so she presented to us, and we liked it. We liked the idea. I think also part of it is, so sabi nga niya, pareho kaming tagline, no? More or less. So we have that in our DNA, the brand DNA, so to speak. The other thing, of course, is apart from the subject of nutrition is also very interesting for Bell-Kenz, in the sense that, well, it's a very basic need. I think you need to address that to be able for the country to move forward and have a better life for all, right? It's a foundational element. The other thing is, of course, in terms of our product portfolio, We do have a couple of categories. We've got the ethical drugs, the prescription drugs, and of course we also have the nutraceuticals, which are the food supplements. No? So that's why nutrition is, of course, a very relevant area of the business.
All right.